Hello, everyone. So, thank you for joining me. Today, we're going to talk about natural product sales as well as challenges in their regulation. So, we're going to talk a little bit about the market, how natural products are defined, what you can expect to see in terms of their quality and verification, and we'll go from there. But firstly, why am I learning about supplements if they don't work? I get this every year. I heard it all the time with my pharmacy classes when I was in school, and even some of my professors would say, "Why even bother learning about supplements if they don't work?" Well, let me tell you. So, you need to learn about natural products because they are the best way that you can catch dangerous herb drug, herb supplement, or herb interactions. If you don't know what to look out for with these products, and you're not going to be able to catch these things when you're doing a medication reconciliation or when you're working in a pharmacy or in a whether it's an outpatient pharmacy, whether it's a hospital pharmacy, Amcare, or just your regular community, you name it. Natural products can also help you better understand how drugs operate in the body because many drugs are also derived from natural products. So if you understand how what they are derived from works, makes sense when you apply it to your other background knowledge in pharmacy. It's also an essential part of cultural competency within healthcare. Many people rely on traditional medicine systems, whether it's traditional Chinese medicine, Ayurvedic, or Indian medicine, uh, various medicinal systems from East Asia, South Asia, Africa, Europe, traditional folk medicines, all the way to Native American and Indian medicines and cultures through Central, South America, North America, as we go across the globe. So many of these folks who come into the pharmacy might also be taking traditional medicines, which you aren't even aware of. It's also an essential part of preserving and respecting traditions. Natural medicines, natural products can certainly live alongside traditional or more Western medicines. And there's a way to strike a balance between those, between the supplement and herbal medicine use versus our Western prescription medicine and over the counters today. And you can also get clues for developing the next generation of pharmaceuticals. I often say in my classes that nature is the best chemist. Many of the things that we've found that become extraordinarily impactful within the world of medicine, be they opioids from the opium poppy in the foothills of Kandahar in Afghanistan to the rainforests of the Central and South America and the Caribbean, where we found the Madagascar periwinkle and eventually led to the development of the very powerful chemotherapy drug vincristine and vinblastine. The next natural product breakthrough might lead to the next drug breakthrough and the next disease breakthrough as we examine these things. But most importantly, if you take anything else away from this, even if you are not a natural product believer or what have you, or a natural product skeptic, even if you don't believe that the most natural products work, people will still be taking those natural products. So you better know what they're doing in their bodies when they are your patients and they're going to take them regardless of if you say they work or not. So, who's the one taking this? I like to put this graphic in to sort of remind us of the biggest demographic group. The demand for herbals has grown primarily through an aging population. We have baby boomers coming of age, getting to where they're later on in life, and they're living longer. We have an increase in life expectancy within the United States and the world at large. As we live longer, we search for alternative health solutions. And there's also a rising interest as well in attaining wellness through diet and herbs, moving away from more Western or traditional medicines, or I should say Western or like pharmaceuticals, and erring more towards traditional medicine use and looking to our ancestors or looking to uh, other health and wellness practices. Why is that gaining traction? A big part of that is greater accessibility and interest in complementary medicine. We have the internet now. We did not have it back in the day. And these traditional healing practices, whether it's traditional Chinese medicine, you think acupuncture, yoga, complementary medicine practices, they are at our fingertips. You can search right now and you can find a full compendium of traditional medicines, their monographs, testimonials from wellness coaches who use them. There's a lot of information out there. Whether or not it is completely accurate is also a bit of a minefield, but it's certainly driving up interest in herbal medicines. Another thing which is also driving up interest, especially among our senior citizens, those who are 60 and older, 65 and older, are low consumer confidence in prescription medicine because of side effects associated with pharmaceuticals. I don't have to tell you what a standard drug commercial sounds like when it's on the television. So, oh, like take this, it'll help you lose weight. Side effects may include a risk of dying of any number of these ways, bloating, vomiting, nausea, diarrhea, you name it. That doesn't do a whole lot for consumer confidence, as you might imagine. So we have this low consumer confidence on top of really skepticism, warranted or not, of the pharmaceutical industry, which also has boosted this demand. Likewise, increasing healthcare costs. We hear about it all the time. If people are not insured, they're going to look for wellness that is not just reactive, not just reactive wellness. They're not just going to look for maybe a quick herbal or over the counter supplement, which they can take if they're feeling very crummy, but they're also really looking for things which will keep them from getting sick, maintaining health as opposed to reactively treating symptoms. That's also kind of where COVID-19 comes in. You'll see it later on in the presentation, the effect that the COVID-19 pandemic had on people's perceptions of wellness and how much they actually bought these herbal and natural supplements. So the demand for herbals, uh, from a large market perspective, the global dietary supplement market size is expected to showcase an exponential growth by reaching, this is USD or US dollar, $117.92 billion as a total market by 2027. This was Fortune magazine in 2020, and you'll see later in the data, their number pretty much tracks. What has this been driven by? A rapid advance in science and technology in terms of supplement development, especially combination supplement development, which we'll talk about later. It's happened with the propagation of traditional use of plants for medicinal purposes. What does this mean? Well, people immigrate to different countries. People bring their cultural practices with them. As these immigrant diaspora communities continue to flourish across the globe in different areas, they'll bring with them their traditional practices. Where there's a market, these herbals will follow. And before you know it, you can go to a traditional Chinese medicine practitioner, maybe in Chinatown in Boston, Mass, or you can get traditional South American and Indo-American, Central Mexican folklore medicines, I'm sure in Southern California and Southern Texas and other areas. The diaspora moves, and so do the medicinal practices. And that in turn is growing popularity due to changes in demographics. We are an increasingly multicultural society, and that multicultural exchange of ideas, exchange of wellness practices, ultimately leads to a higher demand. So the growth of the supplement industry, I used to say that it's growing completely exponentially within the United States. Um, and it's true to say that they have greatly increased within years. However, you can see this gigantic spike. Before 2020, what could have ever happened in that year? Before 2020, in 2017 and 2018, 2019, we had rather consistent market growth between about 8 to 9% of the total sales going up by that amount. COVID hits and everyone wants their supplements. They can't get to their doctor. They're looking for immune boosting supplements. You name it, they want to find them. So COVID had a 17.3% change since the previous year. 2021, that change, we got another little sort of ripple from that high point. And then in 2022, people finally calmed down a little bit from COVID, rightly or not. And by 2022, we actually had the first negative year in about 20 years in terms of supplement growth. But realistically, that was just sort of the market resetting to baseline, resetting to the typical percent change that we might see in any coming years because it grew so rapidly in 2020 and 2021. So the growth of the normal supplement market now is returning to a more post-COVID level, and you could probably expect to see this percent change. We don't have the data for 2023 to 2024 yet, the changes there, but I would assume it's probably around 5 or 6% as we work our way back up to an increase in sales again. Overall, the total trend is that pharmacies have experienced a 45% increase in sales of herbals since the 1990s. So it's just going up. And about 19% of people using prescription medications also take herbal supplements or non-vitamin and non-mineral supplements, which is why I always say make sure in your OSCEs, ask about herbals and teas, because chances are 1 in 5 people are taking them. So as you can see, this is just in a graph form. The total U.S. retail sales of herbal supplements 2015 to 2023, it is quite clearly $1 billion industry, even if it flatlined a little bit in the immediate years post 2020. Now, this next slide makes me nervous, and I'll tell you why. So consumers are trending more towards combination, or as they put it, combo supplements in recent years. To put it into perspective, we started with 42.2% of sales of uh, this is in billions of dollars, these total sales within the supplement market of combination supplements. So these are supplements that have multiple herbs within them. A combination supplement has at least two or more herbal remedies jam packed into whatever the pill is, or the tincture, or the lotion, or the cream, you name it. These combination supplements have increased by about 6.7% in sales in over the course of 5 years. And as we look at this, it's competing more and more with these single herbals. Whereas the single herbals were about like 57.8% in 2018, they're just down in 2023 to 51.1%. What are the problem with these combination supplements? Interactions. So it's one thing to say, like, oh, this is an herb and I know it interacts with the patient's blood pressure medication. Fine. We know that. They're taking the one herb. We can tell them, oh, stop taking that herb. Uh, what happens when they're taking a supplement that has 10 different herbals or vitamins or whatever combination of the two? What happens when they have a 10 part supplement that they're consuming? Well, not only do we have herb drug interactions, so any one of those 10 herbs could potentially interact with one of the drugs that they're taking, and that's not mutually exclusive. You could have two herbs interacting with the same drug, even though it's just one supplement. There may be drug-drug interactions. There might be herb-herb interactions. The herbs within the supplement itself might interact with it. I didn't put it here, but the herb supplement interactions, if they're taking other supplements that are competing with that supplement, oh, you bet there are going to be some interactions between those two products. And then there are also broad food interactions too. Are any of them CYP inducers? Are they going to cause inhibition of metabolism? For instance, I think of our CYP 450s and grapefruit, freonocoumarins. Uh, there's also fewer applicable studies to support the efficacy of combination drugs. So when you're taking a combination or a combination supplement, when you're taking a combination supplement, sure, maybe these 4 herbs or something that are in the supplement were tested individually and they had some efficacy in treating a disease state. But how many trials actually have the co-administration of 4 separate herbals all together in one supplement at the ratios of which that combo supplement is made up of? There's very, very few. So the health implications of fewer applicable studies to support the combination supplement's efficacy, that's where we also get worried, in addition to those drug interactions. And it just makes it really difficult for you to do MTMs. Because if that combination supplement has a name like, I don't know, total pure detox supplements, you have no idea what herbs are in that if they actually bring in the bottle. And unless they actually bring in the bottle or you're able to Google it easily and the patient remembers to bring in the bottle, the patient remembers the name exactly, it's going to be difficult to effectively manage the patient's medications in an MTM setting, in an OSCE setting, or otherwise when you're trying to reconcile their medications and supplements. So our top selling herbals are heavy hitters within the retail market in the US. The top one is turmeric. You can see the sales there. It's massive. If we go to the next page, I have a breakdown of what each of these top 10 ones does. Now, these are the top 10 best-selling natural products of 2023 within the United States. These vary every now and then. Sometimes folks get bumped out of the top 10. Other ones are staying there pretty consistently. Turmeric is one of those that stays there pretty consistently. It just so happens to be bumped up to number one this year. Turmeric, quite a powerful, and well, I shouldn't say powerful, but it's quite well utilized anti-inflammatory drug coming from curcuma longa. It comes from these little rhizomes right here, which have that natural orange powder that can be taken in an extract or most effectively used topically. I won't spend too much time talking about which each one of these top selling natural products does, because that'll be your next lecture. Uh, Cannabidiol, which I don't mention in your next lecture, but you've probably heard, is of course CBD derived from cannabis species. And it's kind of used as a cure all, but it's mostly associated with pain relief, mental health. So if it's ingested, it's supposed to help with anxiety, depression. Sometimes it's also used in PTSD patients, but general anxiety disorders. And topically, it's quite popular for pain relief. If you indeed use medicinal cannabis with like someone has a card or something, a patient taking CBD could certainly use a high CBD product to work on pain relief, maybe related to cancer, to increase appetite, to decrease potential for nausea and vomiting, chemotherapy induced or otherwise. It's quite a versatile supplement, so it's getting legalized in more and more states, so it's no wonder that it's climbed to number two. Elderberry down here, for very popular for immune health, used to be number one. It was number one back in 2020 with COVID. Elderberry and echinacea, which got kicked out of the top 10 here as well, were our two immune supplements which were most popular during the height of the COVID pandemic and indeed in the years shortly after 2020. Mushrooms are also taking a hold. I don't talk about them because they're not plants, but they're generally used for immune health, sometimes cognition. It really depends on which type of fungus you're looking for the supplement. Ashwagandha is getting more and more popular as well. Withania somnifera is the Latin name for sleep, cognition, and mood. Followed by wheatgrass, milk thistle, popular detox supplement. Aloe, it's no kidding that aloe sales would certainly spike, especially around the summer in the United States as we treat all of our sunburns after going to the beach or going outside. Psyllium, which I will come to in the next lecture as well, this is actually interesting because this doesn't even count the laxative sales for psyllium. This just counts the supplement sales for psyllium, which is being marketed as a cardiovascular supporting and digestive health supplement, even though its real primary indication and the most evidence behind it, the most research behind it, is that it is a effective bulk laxative and stool softener. And then oregano snuck into the top 10, which warms my heart as an Italian American. It's quite good for immune health, digestion. There's some evidence, but it seems to be sort of all the rage right now. And of course, the cannabidiol market, I can see a world where CBD is going to supersede turmeric, just in terms of what the market growth uh, of CBD is expected to be within basically the next decade. I have the 11 through 30 here just for your information. You might be familiar with some of these. If not, definitely Google some of them on your own. See what your patients are taking, see what they might be interested in, because statistically, they are most likely to be taking one of the top 30 supplements. Now, statements about supplement manufacturers. We get a lot of these. We get a lot of these from patients, and regrettably, I get a ton of these from other pharmacists and my peers, and I have to correct oftentimes misinformation. Uh, so no one knows what's in these supplements. They don't do any testing on their products, and they're not regulated by the FDA. Uh, that is not entirely the case. And let me make sure you understand. Who regulates the supplement industry? Yes, it is the FDA. The United States Food and Drug Administration regulates the supplement industry. So the FDA, by law, and has its own standards, prohibits the adulteration and misbranding of dietary supplements and natural products. And the FDA is responsible for taking action against adulterated or misbranded products once they reach the market. So the FDA can do anything along the lines of sending warning letters, it can issue recalls, they can take legal action against the companies or the stores which are selling these products. And we used to have at URI when I took a lecture talking, I think it was our law lecture where a person who worked for the FDA and their quality inspection service. He came in and he told us stories about how he would literally go from CVS and Walgreens and pharmacy to pharmacy, pulling certain banned products off the shelves, seizing them by the authority of the FDA. Because there was a serious recall and they couldn't wait for the stores to destock it themselves. They had to go in. The FDA agents essentially kind of had to raid the stores and say, hey, we're confiscating this. So the FDA has that broad authority to take action in that way. For instance, they can send warning letters. So in July of 2020, the FDA sent warning letters to 7 companies illegally selling Hanover products. And they would say consumers should not rely on these products as an alternative to responsibly limiting their consumption of alcoholic beverages, because the the companies were saying wrongly that these were Hanover cures, which is it's not something that you can't say something cures something unless it's a drug. And these certainly were not drugs, nor could they ever be Hanover cures unless they went through the drug approval process by the FDA and through our drug approval system. The FDA also took action against 17 companies selling products claiming to treat Alzheimer's disease. Uh, so 12 warning letters, 5 online advisory letters. You can get these sent to you as well from the FDA and the NIH. And they did say failure to correct the violations promptly may result in legal action, including product seizure and injunction. So the FDA wasn't playing around. Uh, that being said, the FDA can do all of this within the supplement industry, right? They have the authority to do this. How many people do you think the FDA has? And this was before the current administration. I don't know what it is now, but at least around, say the year 2023, how many people worked in the FDA's dietary supplements department to verify the amount, to verify and look into certain claims that are being made by dietary supplements across the United States? And mind you, we have roughly, I'd say at this point, 60,000 unique dietary supplements that and herbal medications that are registered via the FDA and are on the market currently. So how many people on that FDA team to follow up on any sort of claims or follow up on any shady practices within those 60,000 approved products? The team at the FDA has roughly 30 people. 30. 30 people regulate about 60,000 plus unique supplements, with more being sent to market daily. So, do they regulate the supplement industry? Yes. They regulate it as best as they can. So really, they only go after the most egregious cases that they can find, like this Hanover and Alzheimer's cure business. So the FDA does regulate it, but it struggles to. Now, in terms of FDA regulations, we go into product classification when we're talking about herbal supplements, dietary supplements, functional foods. The FDA regulates food products according to their intended use and the nature of claims on their packages. So the intended use is determined by accompanying labeling claims, advertising materials, or oral or written statements. So if it's a drug, the intended use states that it's intended for the diagnosis, cure, mitigation, treatment, or prevention of diseases. This is the standard that was set by the Food, Drug, and Cosmetic Act of 1938, which gave the FDA the authority to oversee the safety of food, drugs, medical devices, and cosmetics. In terms of a food, that is a product which provides basic nutrition. So, provides basic nutrition, it's a food. If it's a dietary supplement, or if it's a drug rather, it's intended to diagnose or cure, mitigate, treat some sort of disease. So where does that place dietary supplements? Because they don't really fall under either of those definitions. Well, they got defined. It took from 1938, it took until 1994 to define those guys. So the Dietary Supplement Health and Education Act of 1994, abbreviated DSHEA. So when I say DSHEA, that's what I mean. Defined dietary supplements as any product other than tobacco, because that's a whole other can of worms, any product that contains a vitamin, mineral, herb, or other botanical or amino acid and is intended as a supplement to the diet. So prior to DSHEA, herbals which had GRAS status, or generally recognized as safe, GRAS, they could be sold as supplements, but without health claims. We now have current good manufacturing practices, or CGMPs. Those were first established in 2007, but they gave a grace period of about 10 years for companies to apply and get accredited to have CGMP status. Long and short of it is, if something is made in a CGMP facility, generally its quality is going to be better than something that is, say, homemade or uh, I shouldn't say its quality should be better. I should say its standardization should be much better because a CGMP facility has sterile labs and different practices, does stability testing, it undergoes various regulatory guidelines, and it's in compliance with not just the FDA and DSHEA, but other regulatory bodies. So if something's made in a CGMP facility, they use those for drugs too. It's the gold standard of current good manufacturing for both the supplement and drug market. So the way I like to see it is between food and drug in the FDA's view is that it's sort of lies on a spectrum. So you have food down here, which is basic nutrition, and you have your drugs, which cure, treat, or mitigate disease. The dietary supplements, herbal medications, herbal supplements, they fall right in the middle here in health promotion. So they can help promote health, but they do something beyond basic nutrition. They go beyond what a food does to provide a benefit beyond just, your basic protein and carbs and needs. But they don't quite go as far as a drug. They don't cure anything. They're not meant to be curative. But all they are meant to be is in this sort of little gray area in the FDA's view of health promotion. And that's where dietary supplements lie. So, DSHEA's role in current regulations. Products are classified as dietary supplements based on their intended use. So it's not based on any effects they have on the body. It's not based on if they cure something because they're not meant to cure anything. And they're also not based on the composition of the product. They're based on what the product is intended to do or intended to support. Properly labeled dietary supplements are not considered to be drugs. And intended use, in terms of DSHEA, is ascertained, or is they find this out by the accompanying labeling claims, advertising materials, or oral or written statements. So, for instance, saw palmetto. It's quite a popular supplement to support uh, patients with BPH in terms of decreasing the size of their prostate and ensuring that they don't have as many urinary issues with an enlarged prostate. So saw palmetto can be used for prostate health or to support prostate health, but not to cure prostate cancer. You can't make a disease claim. Cheerios actually got in trouble. Cheerios are known as the heart healthy cereal. They got in trouble a while back because they can't cure heart disease, but they can help lower cholesterol with an asterisk as part of a healthy diet. And then they talk about 3 grams of soluble fiber daily, blah, 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 in a diet, natural saturated fat. They go on and on, but they qualify. They always have a qualified health claim. So Cheerios can't cure heart disease, but they can support heart health as part of a healthy diet. Dietary supplements in the store, any ones that you'll see will have this little disclaimer right here. Per DSHEA, the label must bear the statement that this product is not intended to diagnose, cure, or prevent any disease. Substantiated structure function claims, or SF claims, sometimes abbreviated, are allowed. However, the FDA doesn't examine substantiation, and claims must be accompanied by a prominent label notice stating that these claims have not been evaluated by the FDA. So if a supplement runs their own study or even runs a study through, say, like a university lab or something like that, they would be able to say that as part of a healthy diet, this supplement may uh, support a decrease in your cholesterol over 6 months. And then they'd star it, and in a perfect world, they'd cite their sources. But the FDA is not evaluating that. So if they cherry picked data or if they self-funded their own study that got a positive outcome for them, you have to take that with a grain of salt. Disease claims are also prohibited. So here's the difference between a structure function claim and a disease claim. Helps promote digestion. That is permissible. A disease claim would be like it heals stomach or duodenal lesions. It's healing something. That's you can't say it heals something because it's not a drug. You can't say you can say as a permissible structure function claim that it helps curb appetite to help with weight loss. So it'll decrease your appetite to help with weight loss. But you can't call it a diuretic because that's the name of a class of drugs. You can't call it an obesity treatment, right? Your dietary supplement's not going to fall into the same category as Ozempic or something like that. So your different claims allowed, you can have claims for nutrient content, that goes without saying, your structure function claims, which we just described, your dietary guidance, which describes the health benefits or broad categories of food. You can have a qualified health claim, which conveys a developing relationship between diet and the risk of disease, as allowed by the FDA and supported by credible scientific evidence. Perfect example of that is the qualified health claim made by Cheerios right here, that it can help lower cholesterol with this guidance based on the FDA, right? Health claim conveys a relationship just like a qualified health claim, maybe with a fewer details, or if it's a better established tenant or a better established relationship that doesn't need the full qualified clarification like Cheerios needs. Meanwhile, certain countries like Singapore, they have to completely block that out entirely. No qualified health claims allowed. Now, beyond the FDA, which, as we've learned, it really has a hard time sometimes regulating these things, even though it's in charge of regulating them, the FDA is woefully understaffed to do so. We have worldwide quality associations for herbal medicines, which can help us sort of see if a supplement is up to certain standards. The best one, in my opinion, to look for on the bottles of any supplement that you find in your pharmacy would be the USP. And there's usually a USP logo. That's the United States Pharmacopoeia. The logo either looks like this or sometimes it comes in a little circle and you can see it on the bottle. The USP certification uh, is the United States Pharmacopoeia, which is an independent body. It's a private organization, but often it contracts with the government agencies like the FDA to do inspections of certain facilities. So if a facility is USP certified, that means that it is in compliance with current good manufacturing practices. So recall back our CGMPs, our current good manufacturing practices. If it's USP certified, that means the USP inspectors went to the facility where that supplement is made and they checked all the boxes. They made sure that they were using sterile practices, that things weren't adulterated, that there weren't any issues with the manufacture and contamination of the resources, and they were able to give it the stamp of USP approval. There are other pharmacopoeia around the world. The British, European, Japanese pharmacopoeia monographs are also quite good for drug references and herbal monograph references as well. German Commission E monographs are also quite good and seen as a standard. Much more popular in Europe, but you can also get them from through our drug libraries here in the U.S. The American Herbal Pharmacopoeia, British Herbal Pharmacopoeia as well have a bit more information on I would say more herbal products, even on a brand name basis, which is nice. There are traditional Chinese medicine and Indian Ayurvedic compendia or compendiums. These are massive texts and massive databases on all of the different traditional Chinese medicine and Ayurvedic concoctions. When we were talking about combination supplements in traditional Chinese medicine, it's not unheard of to have a combination of anywhere between 12 to even 80 different herbs in one tincture or one. Sometimes the literal translation sometimes is even potion. So even in one potion, there might be a myriad of different herbals. So it's good to get that perspective, especially if one of your patients is maybe regularly using TCM or Ayurvedic medicine. There's also the Association of Official Agricultural Chemists, or the AOAC, Dietary Supplement Method Validations. These guys make sure that things aren't contaminated. They make sure that to do quality testing from a chemicals perspective to make sure, for instance, there are no heavy metals or lead or other contaminants within on like a farmer's level. So as these things are harvested. And we also have the NIST Dietary Supplement Quality Assurance Program, which also hopes to provide quality assurance in addition to USP and the FDA and all of these other agencies. So I mentioned adulteration. Adulteration being that essentially something is not as it appears. Something has gotten into a herbal medicine that either makes it not the same herbal as was advertised or either contaminates it. So adulteration, there's about three reasons why something might be adulterated. Number one, this is probably the most common, is economically motivated adulteration. So, for instance, if there's a poor harvest of one herbal product, suppliers or manufacturers might just substitute the product with something cheaper and more widely available. So it's lot it's not great, but I would say if you want to avoid economically motivated adulteration, the general rule of thumb with supplements is you get what you pay for. The quality of a dollar store supplement is not going to be the same as something you get that is USP certified from Vitamin World or the Vitamin Shop or something along those lines. Another reason for adulteration is mistaken identity, and this unfortunately can lead to severe complications. So look at these two plants right here. They look quite similar, but the harvesting process, unfortunately, they grow next to each other in a lot of areas, especially in TCM and in the Chinese Southeast Asia and southern China. And in 1993, this was an infamous example. Mistakes were made during the harvesting, which led to the substitution of Aristolochia fanshi, which is a vine that constituents are used in TCM for weight loss. So it was marketed as a weight loss supplement. And it was, that's this one right up here. It was mistaken during harvest in one like specific lot, one specific group that was harvested, with Stephania tetranda, which is another vine species. So both of these things grow like a vine. Even their flowers look very similar. So like I can see how they get mixed up. However, the toxin in S. tetrandra is extraordinarily nephrotoxic. So one bad batch ended up in Belgium, and it sent about 105 Belgian patients into kidney failure, with many of them requiring dialysis. So they had severe kidney injury just because some farmers in China, when they were harvesting this, made what I think is honestly an innocent mistake. However, this could have been so much worse had they not had Belgium and the Belgium authorities not pulled it when they did, not figure out when they did, when they had this cluster of kidney injury in a few cities in and around Antwerp, that they were like, okay, this is a serious issue. We need to deal with this now and get this all off the shelves. Also, we might have inadequate quality control practices or negligence, and this could be due to a combination of the factors above. Maybe the facilities aren't well financed enough to comply with current good manufacturing practices, and that leads to contamination seeping through in the compounding process and the manufacturing process when these herbals are put together and then sold. Again, mistaken identity, it can happen to anybody. You can see foxglove right here, digitalis purpurea. That is where we get digoxin from, that naturally occurring cardiac glycoside, which we use to treat arrhythmias among other conditions. However, we also have plantain, literally just bananas, plantago major. But it looks so similar, and they can both grow in similar climates. However, if you ate one of those leaves, you would be in for a very bad time. There's other reasons for adulterating things, namely to make them even look better. I mean, you can add dyes to things. You see companies substituting saw palmetto extract with palm oil, which essentially does nothing. People work on workarounds, and they unfortunately, this is very prevalent in the industry. When there are false or misleading claims, there are other options which the federal government can do to step in addition to the FDA. So, as I said, the FDA might issue a cease and desist warning letter to a company. It might issue public advisories or warnings. It can pursue legal action, or it can recall and seize the items within the marketplace. However, we also have the FTC, or the Federal Trade Commission, and that has the authority over the marketing and advertising of dietary supplements. Often they work hand in hand with the FDA. If the FDA informs them, hey, this supplement is saying some crazy things about its claims, the FTC might get involved, especially in regulating the advertisement or the promotional activities of these supplements. So let's look at a high profile example. Anybody ever drink POM Wonderful? Uh, it's a pomegranate juice supplement company based in California. It's delicious, by the way. I am not knocking pomegranate juice whatsoever. If you can afford to buy that, it is a wonderful drink. The irony of this, though, is that POM Wonderful actually started off by suing Minute Maid for selling pomegranate juice. And so between 2008 and 2014, Minute Maid pomegranate juice was under fire by POM Wonderful because they were saying it didn't really have enough pomegranate in it. And that was kind of true. The Minute Maid pomegranate blueberry flavored blend of five juices was misleading because it contained 0.3% pomegranate juice and it was 99.4% apple juice. I mean, that's kind of skimping on it, don't you think, guys? And the Supreme Court, this went all the way up to the Supreme Court. It ruled in favor of POM Wonderful's citing the Food, Drug, and Cosmetic Act. So that act, all the way back in 1938, landed in POM Wonderful's favor with that lawsuit. However, it seems that POM Wonderful didn't learn anything from this because in 2010 they started a new ad campaign. And look at this: life support, antioxidant power of pomegranate juice, cheat death. I mean, that's not subtle. That's subtle with a capital D, as uh, I would say. So these are claims that clearly cannot be made. Cheating death with antioxidants. So POM not so wonderful. So in 2010, for that ad campaign, the FDA sent warning letters to POM Wonderful saying that it was promoting its product as if it were a drug, which, I mean, it's literally set up to look like an IV bag there. Uh, Within that letter, they said that false and unsubstantiated claims that their products will prevent or treat heart disease, prostate cancer, and erectile dysfunction, among other things. POM Wonderful contended that the studies proved increased longevity attributable to the phytochemicals or plant-based chemicals in their pomegranate juice. Where do we run into issues? Those studies were only animal studies because mice are basically the same as people, right? And there are also only studies which POM Wonderful created and or financed. So POM Wonderful set all the criteria for success within those studies, and they also financed the studies. So it was, I mean, that's the definition of a conflict of interest. And I'm not knocking POM Wonderful as being a powerful antioxidant. They certainly have antioxidants, and those are good for cellular health and among other things. It's not going to help you cheat death. So what happened? Well, the verdict was in 2016, the FTC, Federal Trade Commission, and the Federal Court of Appeals decided that POM cannot make health claims in its advertising. It has to follow the law just like any other food company. And the Supreme Court declined to POM Wonderful's request to review the court ruling that upheld the FTC's decision. So what do they decide to do next? POM Wonderful ventures into the world of dietary supplements. So introducing POM X, we get a dietary supplement. One capsule is the equivalent to 8 ounces of pomegranate juice, POM Wonderful juice, standardized to the antioxidants in pomegranate extract. And there's been no further litigation by the FTC or FDA because these health claims are allowed under a dietary supplement. However, they're qualified health claims based on POM Wonderful's data, which it got from these flawed studies. So, yes, is it allowed under law? Is it the most ethical way to look at this? Absolutely not. So, that was just one case study. But what have we learned from this presentation, hopefully? Well, we know now that the demand for natural products is still increasing, especially among an aging population. We know to always ask about herbal supplements, teas, tinctures, or natural remedies, especially during your MTMs, especially when you're at the patient consultation window. And we know that the FDA regulates the natural product industry as best as they can. They are regulating it. It just so happens they have to go after the most serious cases. Quality assurance organizations like USP might help you make an informed decision when recommending supplements to your patients as well. So if you take anything away from this, if a patient comes up to you with a bottle from the dollar store and a bottle of Nature Made or something like that that has that USP certification, and they ask which is the best, you're going to go with the USP certification because that has the most evidence and you can verify that what's in that bottle is most likely what it says on the label. So that is all for this lecture. Next, we're going to be doing, it's going to be rapid fire. It's going to be the supplement roundup. We're going to talk about the breakdown of the most popular supplements organized by disease state and counseling points. So I will see you in the next lecture, and thank you very, very much.